gang, this is Dr. Joy here, and you are watching Delivering Joy MD. We are continuing our Super Mama Summer series, and today's video is all about D-Day, Delivery Day. This is so exciting, so make sure you keep watching so you can get all of my tips. Gang, so let's talk all about delivery day prep today. So this is something that a lot of women really stress over, but there's no need to stress if you have all the info that you need to get prepared. So let's talk a little bit first about your delivery date. Now, a lot of women ask me, should I agree to be induced or should I just go into spontaneous labor? And I'm just gonna be really frank with you guys. Again, these are my own medical opinions, and if you find 5 OBs and ask them their opinions, you'll probably get 4 different opinions. So this is what I tell my patients, and really we want to do what's evidence-based. And I'm just gonna tell you what I think, and that is that it really is a choice for the mom to make. In terms of thinking about dates, I usually encourage my moms to set their date for a delivery somewhere between 39 and 41 weeks. There are so many factors that go into whether or not we're going to do an induction versus spontaneous labor. And one of the biggest things that goes into that is your desires and what you want. Some women really stress over what's going to happen if I go into labor at home. Am I going to make it to the hospital? Some women live really far away from the hospital, so there's all kinds of things to consider. Some women have husbands or partners or their support person who works out of town. So there's lots of things to think about in terms of thinking about whether or not you want to be induced versus go into spontaneous labor. So what I recommend my patients do is to start early. So I usually start this conversation at around 36 weeks when we're collecting the last set of prenatal labs. And if you missed my 3rd trimester video, I'm going to link it in the description box below. So what I always say to women is that we need to explore the evidence. And about 2 years ago, there was a study that came out called the A.R.R.I.V.E trial. And I think that there was about 26,000 women that participated in this. These were all first-time moms who were randomized into 2 groups. So they either were induced at a specific time period, in the 39th week of their pregnancy, or they were allowed to go into spontaneous labor before 42 weeks. So the OB community was thinking that, okay, this is just gonna prove that spontaneous labor is better. Well, actually, the trial proved exactly the opposite. We wanted to see if allowing women to go into spontaneous labor reduced the C-section rate, but actually it didn't. And I was kind of blown away by it, but then when I really went back and considered it, it made a lot of sense, because if you continue your pregnancy out to 42 weeks, the baby's getting bigger, the placenta that helps to nourish your baby is getting older, and so these women are more likely to end up with operative vaginal deliveries, meaning the use of forceps or vacuums. They were also more likely to undergo cesarean delivery, and that could be because the placenta is not able to get enough oxygen to the baby and you see heart rate problems, or it could be that the baby had gotten too large and they're not really able to push the baby out. So there were a lot of attempts with forceps or vacuums that just didn't work out, and so the mom ended up with a C-section. So I think that is, again, a personal choice. I think everybody is entitled to their decision as long as there are no medical issues with your pregnancy, like high blood pressure or uncontrolled diabetes or problems with the baby. And I think that it really is a personal choice, and I encourage my moms to decide whether or not they want to be induced, and if they do, then we set that date somewhere between 39 and 41 weeks. So I have moms that want to come in like at 38 weeks and 6 days as soon as they can possibly be there to kind of start the process, so they deliver at 39 weeks. I have moms that want to deliver on their due date. I have moms who want to be induced if they're not delivered by 41 weeks. So it really varies, and I think between 39 and 41 is appropriate in terms of having inductions. We do not do inductions before 39 weeks unless you have a medical complication of pregnancy. And that is because we know that 39 weeks is the time that the baby's lungs and brain are fully developed. I think that that's something that you definitely want to shy away from. If you're asked to be induced prior to 39 weeks, then you need a clear reason why. So if the fluid is low around the baby, or if your diabetes are uncontrolled, or if there's a problem with the baby's heart rate, like there needs to really be a problem if you're going in before 39 weeks. And your OB or your midwife should explain that to you so that you're aware of what's going on and why. I have really encouraged a lot of moms to think about their delivery plan and to go ahead and plan that out in advance. And we've been talking about that throughout the last several videos in this series. So one of the sites that I really like a lot, that I've seen some birth plans from, is a site called MamaNatural, and it really kind of helps women to say what they want and what they don't want in their birth plan. And like we said, flexibility is always key, but we want to be at least thinking about kind of what we would like to see. Don't get married to that idea though, because things may not always turn out exactly the way that you expect them to, and then you feel disappointed, like you failed at your birth plan. Our number one goal is always healthy mama and healthy baby. So be flexible about your plan so that you are not married to it and feel like a failure if it doesn't work out the way you exactly wanted it to. Let's talk about what to pack. So I know that we are doing this video in conjunction with Simply Caitlin, and she is going to be posting some videos on what she packed for her delivery date. One of the things that I want to really bring up is comfort items. So a lot of times people have this idea of the birth that they want to have. They're going to have this massage, and they're going to have a birthing ball, and they're going to have, essential oil diffusing and all these things. Well, those are things that you need to bring with you, because we don't necessarily always have those in the hospital. In my personal hospital, we are really big on pelvic maneuvers. So we have peanut balls and birthing balls and all that sort of thing. But if your delivery hospital doesn't have those, then you're going to definitely want to bring them with you. They're usually pretty easy to get from a place like Walmart or Target, and you can blow those balls up, and you can use a birthing ball or a peanut ball during your labor. Pillows and blankets are also another thing. So if you know you have your favorite pillow, like, I'm not gonna lie to you guys, I have a favorite pillow that I've had since I was really little. It is so dingy and disgusting, but it's called Mr. Pillow, and Mr. Pillow, I could never go into labor without Mr. Pillow. So if you have a special friend, like a little special blanket or pillow that you need that's very comforting to you, make sure you pack that. We promise not to laugh at you. I have seen all kinds of things, from really raggedy stuffed animals to blankets to pillows, you name it, I've seen it. So don't be ashamed of bringing those things that make you feel most at home. Essential oil diffusers are totally fine. Battery operated candles are fine if you feel like you want to have candlelight. We just cannot have open flame in the hospital. Music or meditations or affirmations that you were thinking about, if there's something you want written on your patient board in your room for you to kind of focus on, it's definitely doable. Bring a speaker. We just can't have music up so loud that it disturbs other patients, but if you want to have like a Bluetooth speaker in your room, that is totally okay. Another thing that I encourage folks to bring is something to do. So if you know that you're going to be there for a couple of days, bring some games. I've seen lots of laboring patients and their support people playing Uno or playing cards or Connect Four or whatever kind of game you enjoy, or bring your tablet or bring a good book to read. Because a lot of times, especially if your labor is being induced, it can be pretty boring. So you may be there. You should expect to be there anywhere from 24 to 36 hours, sometimes even longer. So bring something fun to do. You bring snacks, and that you find out about the eating policy at your delivery hospital. For me personally, my patients eat regular food. They eat what they want until they get an epidural placed. And once that epidural is placed, we switch to clear liquids. It may be different for your doctor and for your delivery hospital, so make sure you find out. And if you are allowed to have certain foods or snacks, then you want to bring those with you so that you have them in the hospital. We'll always have something that patients can eat, but it may not be exactly what you want to eat. So snacks are great. And one of the really important things that I say for labor support people is bring a pocket full of change or a Ziploc bag full of change, so that if you decide that you're going to run to the vending machines, you have that, because a lot of times we won't have change for you on the floor, and the vending machine may or may not take debit cards. One of the best gifts that one of my patients received at her baby shower from her dad was a basket full of snacks, and it had hard candies like Jolly Ranchers in them. It had some light snacks that she could eat, and it had a mason jar full of change in it. So that is a really good hack for how to get the things that you need in terms of snacks and drinks prepared for your delivery date. So that's a good thing to put on your baby shower registry. What's in that bag? So I have linked Simply Caitlin's video below about what she packed in her bag, but just general rules of thumb to remember is that you're gonna really pack like you're going away for the weekend. So, maybe a small suitcase with things like your bathroom slippers, your robe, a couple of sets of pajamas. If you have special pads that you prefer to use, you can pack that. I think also making sure you have your toiletry items that you want. We will always have things available for patients, so we might have shampoo and we might have deodorant, but it's kind of like hotel stuff, so it may not be what you are used to using at home, in terms of soaps and deodorants and all that sort of thing. So bring your toiletries with you, and I really do advise packing your bag by 36 weeks. And that's just because at this point, once you're going into the doctor, we don't really know. So if you get there at 37 weeks and you have an elevated blood pressure, we're gonna say, hey, you have an elevated blood pressure. It's time for you to have a baby. And we're gonna be sending you to the hospital. So you wanna make sure that you're prepared, that you got that bag in the trunk every time you go to your visits. And in addition, if you're out just, in these streets living life and your water breaks or something happens, you want to have that bag already packed. You can always go straight to the hospital and let your support person grab that stuff if you need to, but I just recommend keeping it in the trunk so that you're always prepared, because if you stay ready, you don't gotta get ready, right? Other things that you really want to make sure that you bring with you in your little weekend bag is your postpartum support garment. If you're planning to breastfeed, bring your breast pump and your nipple butter that can help avoid cracked or painful nipples. And of course, make sure you got your camera, your cell phone, whatever you're going to be using to get pictures of this amazing event, as well as any chargers that are needed for those items. And if you're trying to be camera ready, honey, make sure you bring your face beat so you can be ready, taking your pictures is all, how we like to do. I love how my patients get totally dressed. I mean, lashes and everything for their deliveries. So that'll be great. If you want to take pictures of your baby in certain outfits, or you want a special outfit for them to go home in, I would definitely bring 1 or 2 outfits, not their whole closet, because most of the time we're gonna just kind of leave them skin to skin with you as much as possible, so they'll just be wearing a diaper, and then we have little t-shirts and onesies for them at the hospital if they need it. But until you kind of get ready to go home, there's really no need for them to put on real clothes. We have hats, we have socks, and all that sort of thing. If there's something special and you want your baby to be totally GQ the entire time they're there, and just extra fly, then yeah, you can dress them, but I wouldn't recommend bringing a whole bunch of stuff to the hospital that you don't necessarily need. Speaking of items to pack for your baby, you want to definitely make sure that you have your car seat. And if you're maybe getting a car seat from a thrift store, or it's being gifted to you from somebody whose baby is too large for the car seat, make sure that you explore that car seat, because it does have an expiration date on it, and you want to make sure that your car seat is not expired. If your baby is smaller than usual, like if your baby is low birth weight or is preterm, then we may ask you to bring that car seat inside the hospital for a car seat test. Just making sure that the baby is able to maintain its oxygen levels even while in the car seat. So just kind of have that car seat with you and available, or if you have an emergency and have to get to the hospital quickly, then a support person can bring it up there for you. If you are planning to give your baby a pacifier, which we tend to discourage for women who are breastfeeding or who are new to breastfeeding, then you will need to bring that pacifier with you at most hospitals. And that's just because we are really moving towards what we call a baby-friendly atmosphere. And that means that we're not doing things that help promote formula feeding. It's okay if you decide that you want to feed your baby formula, but generally we're really getting away from promoting formula feeding, because we know that it's just simply typically not as healthy as breastfeeding. So we're really doing everything that we can to promote breastfeeding, and that means that we're not giving your baby a pacifier unless you specify that they should have one and unless you provide it. For some procedures like circumcision, we do have pacifiers available, but that pacifier would need to be ordered by the pediatric staff at our hospital. So we don't just automatically give babies pacifiers anymore. If you are going to do a memory book for your little one, make sure you bring that with you too. So don't leave that out of the bag. If you want handprints or footprints, or the doctor to sign your book, or if you've got a stuffed animal that you're recording all your information on, make sure you bring that with you. If you're gonna do a little door tag that announces your beautiful baby's birth to the entire floor, bring that with you. So let's say we've got all this planned and now it is time for D-Day. What do we do next? If you are doing spontaneous labor and you are coming into the hospital and it maybe is after hours, say like 2 or 3 in the morning, and you're trying to get in, generally you're gonna wanna go through the emergency department entrance. And that's just generally speaking. But what you should do is map out where you go based on what time it is. So most hospitals have a registration area where you can check in during normal business hours, but many times after hours, emergency department is the place to go first to check in. And they're going to get you checked in and get you up to labor and delivery. If you're coming in for a scheduled induction of labor, usually you're gonna go through general registration. So map that out, drive by your local hospital that you plan to deliver at, and just see where everything is, because if you happen to go into spontaneous labor, chances are everybody's, a little bit frazzled. Make sure that you've mapped out how to get to your hospital, what area you should go into. If you come in after hours, is it going to be the emergency department, or do they have a 24-hour registration area? So make sure you know where that is. Make sure you know where your delivery hospital is and that you've been by there at least once. Make sure you know what floor labor and delivery is on. Make sure you know how to get there. So I would definitely advise doing a labor and delivery tour if that's available at your facility, or at least calling to get the information about what to do when it's outside of normal business hours, so that you know what to do if you go into labor. If you are going in for a scheduled induction, usually you're going to arrive during a time where the registration center is open. And so you'll go to main registration usually, but in the event that main registration is not available, you're gonna go to the emergency department, just like our spontaneous labor moms. So if you are coming in and you're planning to do spontaneous labor, there are a few things that you may want to keep in mind. Number one, with coronavirus, you probably will be asked to do a rapid coronavirus test when you report in labor. Number two is that the doctor who you've been seeing in the office may or may not be available or on call for that date. So I've had some patients be really disappointed, and some even downright mad, when they get there in spontaneous labor and I'm not there. Well, I don't live at the hospital. Your OB does not live at the hospital, and they may or may not even live close enough to the hospital to get there in time. And they may have something else planned. They might be, spending time with their family. So with spontaneous labor, it is exactly that, spontaneous. And so who you see in the hospital in terms of delivery doctor may also be spontaneous. Nothing wrong with that if you're okay with that. But if you're the type of person who's not going to feel comfortable if your OB isn't there, then definitely discuss that so that you kind of plan things so that you're there with your OB. And that's really ideal. The person who's been taking care of you is the person who will do your delivery. But if you have some reason that you're not able to be with your particular OB, don't freak out. Hospitals don't credential doctors who are not board certified for the most part. So this means that this person has been certified to do this job and that they're probably going to do a pretty good job. I mean, I personally think that I take the best care of my patients, but we all think that. You're best to put on a brave face and get to know the doctor that is there. If you have concerns about your safety or you have concerns about that physician, then ask questions. Ask lots of questions. And if you feel like, you guys are not vibing right, just say, listen, I have some concerns, and address those. And I think pretty much anything can be worked out. If you have questions about what the doctor is doing or has ordered, ask those questions. It's totally okay to do that. If you're feeling really uncomfortable, you should say so. So I'm going to teach you girls how to cuss today. I mean, not literally, but cuss. C stands for concerned, and that's where you say, I'm concerned about this particular issue, and I'd like to talk with my care team, my nurse and my doctor about it. Or if something's happening that you're really uncomfortable with, like say if you're really uncomfortable with exams being really rough or something like that, it's totally okay to say, I feel really uncomfortable about the way in which you are touching me or checking me. There's nothing wrong with that. If they're not really listening when you say I'm concerned or uncomfortable, then you say, I think this is a safety issue. And I guarantee you that like that, people are going to start saying, oh, okay, she's aware of what's happening. We need to do something different. So don't be afraid to speak up and advocate for yourself. So cuss. Say, I'm concerned, I'm uncomfortable, I think this is a safety issue. So we need to be really vocal about those things. Unfortunately, in our country right now, there's a lot of maternal morbidity and mortality that's occurring, especially in my state in Georgia. So, I don't like for patients to be like an adversary of anyone on their care team, but I do like patients to be informed, and I do like them to feel comfortable speaking up. Don't be afraid to speak up if you're concerned, if you're uncomfortable, or if you feel like your safety is at risk. So in terms of the delivery, there should be what's called a consent for treatment. And we are consenting you, at my office anyway, for delivery, for vaginal delivery. We are consenting you for blood or blood products in the event that you need them. And we're consenting you for emergency C-section if necessary. So I like to do these beforehand because we can have a talk about that in the office, and you can talk to me about what your desires are and what your wishes are. In terms of consenting for vaginal delivery, you want to make sure that you read through that, because you may also be consenting for operative vaginal delivery, and that means use of a vacuum or forceps. Once you've kind of looked into vacuum and forceps use, you will know that there can be risk of birth injury to babies. Like babies may be bruised or on their head, or sometimes have damage to the face or the head with forceps. You can see bruising or even cuts on babies. So used properly, a vacuum is actually not super dangerous, but you can get bruising in this baby's scalp from that. And so you want to make sure that you're aware of that, and you want to ask questions. Used properly, a vacuum can be a really great tool, but used improperly, a vacuum can be damaging. And the same thing is true with forceps. I tend not to be excited about forceps, and I only use them when absolutely necessary, because they are metal and they are going into the vagina, and they do increase your risk for vaginal lacerations. So make sure you talk to your OB about that before you actually go forward with an operative vaginal delivery using a vacuum or forceps. You need to know whether or not your OB routinely performs surgical episiotomies, meaning they're actually cutting the vaginal tissue at the perineum to help the baby come out. I do not. It should not be routinely done, and the American College of OBGYNs has come out strongly against that. So that's a question that you definitely want to ask. And you can ask for things, guys, like say, hey, could you help me protect my perineum during delivery so that I don't, rip, or I don't rip as bad? There's nothing wrong with saying that. And I think that sometimes as doctors and midwives or healthcare providers, we get annoyed when patients do that. And that's just the leftovers of a paternalistic healthcare system, and it needs to die. So don't feel bad about asking questions. We need to get rid of that paternalism in medicine. We don't tell you what you're going to do, but we talk to you about your treatment plan and help you understand the risks and the benefits, and then we make decisions together. No one should be doing anything to you without your consent, and they should be willing to explain in normal layman's terms why they are asking you to consent to a particular treatment plan. So a few things that you should know going into the hospital, and it's unfortunate that I have to ask patients to know this, but I really think that your health care is your business and it's your responsibility. But I think it's very important for you to know a few things. A, your blood type. B, what your starting blood count is. So your hemoglobin level is really the level of oxygen carrying capacity that your body has at the time that you go in. A lot of women during pregnancy will have low blood counts or anemia. And anemia in pregnancy, actually most of the time, is normal. It's delusional. It's where you have made so much more fluid in your blood than what you're normally used to having. And so it actually increases your blood volume so that when you lose blood, it's not as bad. But I really like women to know if they're severely anemic, especially if their hemoglobin is less than 10, then I really like for you to know that going in so that you have some idea. And if you know that you seem to be losing a lot of blood and they're doing a lot of things in there to try to control your bleeding, be aware of that and say, hey, you know, my blood count was already pretty low. Sometimes you saying that out loud sets off a bell in the doctor's head and says, hey, we need to check that blood count again and make sure that she's not getting too low. You should also know if you have any history of postpartum hemorrhage, or if you've had poor outcomes with other deliveries, like you passed out or you had seizures or something like that. That's something that you definitely want to inform your labor and delivery nurse about and your labor care team about if you have any events that took place during prior delivery, especially postpartum hemorrhage, because that is something that can, you know, really make a difference if we're prepared for postpartum hemorrhage. And we should all be prepared. Every hospital in the United States who is part of the Joint Commission of Hospitals, they should have a postpartum care plan that they're ready to initiate at any moment's notice. So if you have had a postpartum hemorrhage, you want to definitely make your care team aware of that so that everything is prepared in the room for you in the event that you have another postpartum hemorrhage. I think it's totally okay to ask what your quantitative blood loss is. And I like to say that out loud in the room for everybody to hear so that the patient is aware. So right now, the guideline for C-section says that losing more than 1,000 milliliters or 1 liter of blood is too much for C-section, and more than 500 is too much for after a vaginal delivery. I think it's very wise to know how much blood you've lost and to ask questions about that if there is anything that needs to be done. At 1,500 mLs of blood loss, we should be considering transfusing you 2 units. That is considered a stage 3 hemorrhage, and we should be considering a blood transfusion if you have lost 1,500 milliliters of blood. So don't be afraid. Support people to speak up. If you hear, oh, well, the QBL is 1,600, then you may want to say, hey, well, are you guys going to transfuse her? Or how is this going to work? Or what are we doing to control bleeding? There's nothing wrong with that. And in fact, again, it sets off alarm bells, because when patients are aware and they're educated, they get better care. And that's unfortunate, but it just is what it is. So I hope this makes you feel a little bit better prepared for delivery day. It's an amazing time, and we're gonna be sharing some birth stories from 2 of my patients, one who had a vaginal delivery and one who had a C-section, and we're gonna just be talking about their experience. So I'd love for you to catch those videos. Make sure you subscribe and share this video with someone who can use it. If you think it was a great video and you're feeling more prepared, give me a thumbs up. I would love to talk to you about this topic in the comments. So if you have questions or you want to just kind of share your story of your delivery day, I would love to see it. So post that in the comment section below, and we will catch you on the next video. Peace.
See you soon, girl gang. Don't forget to subscribe and comment below.